Intuniv, a commonly prescribed medication for attention deficit hyperactivity disorder, ADHD, has emerged as an effective treatment option. Curious about how it works? In this video, we will delve into the Intuniv mechanism of action and its crucial role in managing ADHD symptoms. Intuniv contains a compound called guanfacine, a selective alpha-2A adrenergic agonist. By targeting specific receptors in the brain, this medication helps regulate the levels of norepinephrine, a neurotransmitter involved in attention and impulse control. By doing so, Intuniv helps improve focus, reduce hyperactivity, and enhance cognitive functioning in individuals with ADHD. Understanding the mechanism of action of Intuniv is vital for patients and healthcare professionals alike. It enables them to grasp how this medication affects the brain and assists in managing ADHD symptoms effectively. If you're seeking comprehensive knowledge about Intuniv and how it works, this video is a must-read. Discover how Intuniv's mechanism of action contributes to the treatment of ADHD and gain valuable insights into managing this condition for a better quality of life. Let's explore the science behind this medication and its role in ADHD treatment. What is ADHD? Attention deficit hyperactivity disorder, ADHD, is a neurodevelopmental disorder that affects both children and adults. It is characterized by symptoms such as inattention, hyperactivity, and impulsivity, which can significantly impact daily functioning and quality of life. ADHD is a complex condition that involves various factors, including genetics, brain structure, and neurotransmitter imbalances. ADHD is commonly diagnosed in childhood, with symptoms often persisting into adolescence and adulthood. It can affect academic performance, social interactions, and overall well-being. While there is no cure for ADHD, there are effective treatment options available to manage the symptoms and improve functioning. Understanding the mechanism of action. To comprehend how Intuniv works in the treatment of ADHD, it is essential to understand the underlying mechanisms of the disorder. ADHD is associated with dysregulation of certain neurotransmitters in the brain, specifically dopamine and norepinephrine. These neurotransmitters play a crucial role in regulating attention, impulse control, and executive functions. In individuals with ADHD, there is a deficiency or imbalance in the levels of these neurotransmitters, leading to the characteristic symptoms. Medications like Intuniv target these neurotransmitter systems to restore balance and improve symptoms. How does Intuniv work? Intuniv contains guanfacine, a selective alpha-2A adrenergic agonist. This compound acts on specific receptors in the brain, known as alpha-2A adrenergic receptors. These receptors are involved in the regulation of norepinephrine, a neurotransmitter that plays a key role in attention and impulse control. By stimulating these receptors, Intuniv helps increase the activity of norepinephrine in the prefrontal cortex, a region of the brain responsible for executive functions. This increased activity leads to improved attention, reduced impulsivity, and better cognitive functioning. Unlike some other ADHD medications, Intuniv does not directly affect dopamine levels. Instead, it primarily targets the noradrenergic system, which complements the dopaminergic system in regulating attention and behavior. Benefits of Intuniv in ADHD treatment. Intuniv has been shown to be effective in managing ADHD symptoms and improving overall functioning. The benefits of Intuniv include improved attention. Intuniv helps increase focus and concentration, allowing individuals with ADHD to stay on task for longer periods. Reduced hyperactivity. Intuniv can help decrease restlessness and excessive movement, leading to a calmer and more controlled behavior. Enhanced impulse control. Intuniv aids in reducing impulsive behaviors, allowing individuals to think before acting and make better decisions. Cognitive improvements. By targeting the prefrontal cortex, Intuniv can enhance executive functions such as planning, organization, and working memory. Long-lasting effects. Intuniv is an extended-release formulation, providing sustained benefits throughout the day. This eliminates the need for multiple doses and ensures consistent symptom management. It is important to note that the specific benefits of Intuniv may vary from person to person, and individual response to the medication can differ. Dosage and administration of Intuniv. The dosage of Intuniv is determined based on factors such as age, weight, and individual response. The medication is available in tablet form and is usually taken once daily, preferably in the morning. It is important to follow the prescribed dosage and administration instructions provided by the healthcare provider. The initial dosage of Intuniv is typically low and gradually increased over time to achieve the optimal therapeutic effect. It is important not to stop or adjust the dosage without consulting a healthcare professional, as sudden discontinuation can lead to withdrawal symptoms or a worsening of ADHD symptoms. Side effects and precautions. Like any medication, Intuniv can cause side effects, although not everyone experiences them. Common side effects may include drowsiness, fatigue, headache, dry mouth, and constipation. These side effects are generally mild and tend to improve over time. It is important to report any persistent or severe side effects to a healthcare provider. Intuniv may also cause changes in blood pressure and heart rate, particularly at higher doses. Before starting Intuniv, it is important to inform the healthcare provider about any existing medical conditions, especially heart problems. Regular monitoring of blood pressure and heart rate may be necessary during treatment. Additionally, Intuniv may interact with certain medications, such as antihypertensives and central nervous system depressants. It is important to disclose all current medications, including over-the-counter and herbal supplements, to the healthcare provider to avoid potential drug interactions. Effectiveness of Intuniv in clinical trials. The effectiveness of Intuniv in managing ADHD symptoms has been demonstrated in several clinical trials. These trials involved children, adolescents, and adults with ADHD and compared the effects of Intuniv to a placebo. In a large-scale study involving children aged 6 to 17, Intuniv was found to significantly reduce ADHD symptoms compared to the placebo. The study showed improvements in attention, hyperactivity, and impulsivity, as well as overall functioning. Similar results were observed in trials involving adolescents and adults with ADHD. Furthermore, long-term studies have shown that the benefits of Intuniv can be sustained over extended periods of use. These studies indicate that Intuniv can effectively manage ADHD symptoms for up to 2 years without significant loss of efficacy. Comparing Intuniv with other ADHD medications. Intuniv is one of several medications commonly prescribed for ADHD. Each medication has its own unique mechanism of action and benefits. Comparing Intuniv with other ADHD medications can help healthcare professionals determine the most suitable treatment option for each individual. Stimulant medications, such as methylphenidate and amphetamines, are often the first-line treatment for ADHD. They work by increasing the levels of dopamine and norepinephrine in the brain, leading to improved attention and reduced hyperactivity. Stimulants are generally effective in managing ADHD symptoms but may have potential side effects such as decreased appetite, insomnia, and irritability. Non-stimulant medications, like Intuniv, provide an alternative treatment option for individuals who do not respond well to or cannot tolerate stimulant medications. Non-stimulants have a different mechanism of action and may be better suited for individuals with certain comorbidities or sensitivities. The choice between stimulant and non-stimulant medications depends on various factors, including individual response, preferences, and specific needs. Healthcare professionals can assess these factors and guide patients in selecting the most appropriate medication. Conclusion: the role of Intuniv in ADHD treatment. Intuniv, with its mechanism of action targeting the alpha-2A adrenergic receptors, offers a valuable treatment option for individuals with ADHD. By regulating norepinephrine levels in the brain, Intuniv helps improve attention, reduce hyperactivity, and enhance cognitive functioning. Understanding the mechanism of action of Intuniv is crucial for patients and healthcare professionals alike. It provides insights into how this medication affects the brain and assists in managing ADHD symptoms effectively. Intuniv has been shown to be effective in clinical trials and offers benefits such as improved attention, reduced hyperactivity, enhanced impulse control, and cognitive improvements. As with any medication, it is important to follow the prescribed dosage and administration instructions for Intuniv. Regular monitoring of side effects and potential drug interactions is necessary to ensure safe and effective treatment. By working closely with healthcare professionals, individuals with ADHD can explore the role of Intuniv in their treatment plan and strive towards a better quality of life. Thanks for watching.